Hi, Miss Allie here. I wanted to give you a few suggestions about how to cue or prompt your child if they are working on language goals. So language are things like vocabulary, sentences, making a choice, answering WH questions. Those are types of language techniques or goals. And so we can have receptive language, which is our understanding, like following directions and understanding the question. And we could also have expressive language, which is finding those words and then saying them. So some of your children may be working on both receptive and expressive language goals, and some of your children may be only working on those expressive language goals. And so I wanted to give you a few tips on how to cue your child other than just having them always imitate you. So that's kind of the first tip or way that we cue a child is just have them repeat after us. And that's called imitation, or we as therapists refer to it as modeling or with a model. So I say, this is a dog, and then I say dog, and the child says dog. That's imitation or with a model. Now, one thing that I encourage you to try to do is instead of always modeling the word for your child, use a closed procedure and say, this is a, and see if they can fill it in. If they can't fill it in, then we might want to do what we call delayed imitation. So you might say, this is a dog. What is it? It's a, and you can have them fill it in that way. So you've given them the answer, but you're not having them directly model for you. I use that a lot in therapy, and especially when I'm reading books. So I might ask a question and say, who went to the store? And have them try to answer. And if they don't answer, I'll say, Cordelia went to the store. Who went to the store? And also use that visual prompt, which we'll talk about that in a minute. So give the answer, ask the question again, and then wait and see if they can fill it in. You can use that closed procedure to make it even better. Those closed procedures are when you say a couple of words and then you trail it off at the end and let them fill it in. So that's another technique that we SLPs use a lot. Another thing that you can do is when you're reading a book is to chunk it into smaller sections. So instead of reading several pages and then asking a question, just read one page and ask a question based on that one page. Or even smaller than that, ask a question, and if they're still having a hard time, tell them, I'm gonna reread what the story said. See if you can hear the answer. So you're telling them what the question is, and then they have to go back and listen for the answer again, and then ask the question again and see if they can get it that time. If they can't, you might use things like visual cues in the story. So you might look through the pictures, or in the pictures, you might kind of ask, oh, she was flying like a... And if they're not getting it, she's flying like a, and circling the answer. Or you can also use things like gestures. So flapping your wings or things like that to kind of give them a visual cue without always necessarily giving them the word. So visual cues are something we use a lot in speech therapy and language therapy, and that's a good way to cue them without always modeling that word for them. Another thing we might do is auditory cues. So sometimes you might say, you want the and see if they realize and they can find that word since you kind of just gave them a little bit of a start. Sometimes kids are just gonna go the and they're just going to imitate you. So that means they probably really don't know that word yet, or they just can't find that word yet. So that's when you might do that answer and then ask that question again, or just give them that direct model. Another thing to be aware of is that some certain questions are easier than others. So yes, no questions tend to be easier because you can answer them non-verbally. You can answer with a head nod, or you can answer just yes or no. So those might be the first kinds of questions that we start with in therapy, and then we might move them to a choice question. A choice question would be like, who says woof, a penguin or a dog? Now that's actually a little bit harder than just asking, which one do you want? That is a question that is kind of a preference. And so do you want the penguin or the dog? That's a little bit easier question than who says woof? penguin or a dog. So be thinking about what kinds of choice questions your child can answer. The nice thing about choice questions is that a child can answer by just pointing. So they don't always have to answer by saying the word, but obviously in speech therapy, we want them to be talking. So sometimes we're really going to try to encourage them to say the word. And it's a really nice way to encourage them to say something without always just saying, say dog, dog, say dog. If you give them a choice, it gives them kind of a more natural way of wanting to answer. Another type of question is a what question, like, what is that? We might ask that a lot. So that might not be something that they necessarily want to eat or need to practice. But what about a what doing question? Like, what is that person doing? Or what is the doggy doing? So that's another type of question that you might want to work on. A who question. That's a WH question as well. It gets a little bit harder than those what questions. But again, most of these WH questions, who, what, you can point to answer. So you might be looking at pictures of your family and say, who went on the trip with us? And they can point to answer. So obviously it gets a little bit harder when we're starting to ask some WH questions where they can't point for the answer. The next kind of question that we might work on is where questions. That would be working on and trying to get us a preposition. So an answer that's not always necessarily just one word. That would be a good question to ask. Where is the dog? Or where is the penguin? On your head. So that's a fun one to work on. And then those why and how questions, those are a lot more challenging. So those tend to have a lot more thought behind those questions, and they have to reason a lot more, or also give multiple steps for like a how question. So for things like that, if that's something your child is working on, you might want to do pictures. So again, visual cues so that they can see the steps to how to do something, or kind of talking the reason behind why you do something. So those are, in a nutshell, some of the strategies that I use to cue my children to answer their language questions and to work on their language goals. If you have any questions, feel free to let me know. Thanks.